loss, and we want to help you reverse that trend. And to talk us through it is Dr. Tracy Page, Wisconsin Institute of Functional Medicine. Well, welcome.
Thank you.
So 1 in 4, that's a big number.
Yes.
Yeah, let's talk about hair loss.
Yeah, and we really identify with our hair, especially ladies, they do. And so we do have hair loss. It's natural to lose 50 to 100 hairs a day, but when you start losing that many hairs and you're not regrowing your hair, it becomes a problem.
Now, you talked to me about a PRP treatment that can help that. Let's get into that.
Yeah, so PRP, some people may not know, that stands for platelet-rich plasma. So basically, we draw your own blood, we spin it in a centrifuge, and then we pull out the growth factors. So the things that really help you grow your hair, your own hair. It's a very simple procedure, not a lot of risk involved because it's your own blood, and also too is that we're just putting it back into your scalp.
So that helps heal and generate where the hair loss is, and then what's the timing and what does that look like?
Yeah, so so a couple things. So it does help regenerate the hair, larger hair follicles, also collagen. So you're really going to notice thicker hair. You're going to notice more hair strands. And then as far as the timeline, we usually say it takes about 3 months to do all the treatments, about 3 to 4 months because we do them 6 weeks apart because of the hair cycle, the way the hair grows. And you're going to notice, definitely in 6 weeks, you'll start noticing a change in your hair.
Talk about a confidence boost. I can imagine that your patients after that feel so good, don't they?
Yes, yes. And we really do identify with our hair, and it's something that we take for granted until we start losing it.
Well, let's jump in. Let's talk about androgenic alopecia. What is that?
Yeah, great question. So that is the most common type of hair loss, and usually what you'll see is male pattern baldness. So it'll be at the temples or the crown of the head. And on women, you'll notice that the part of the hair becomes whiter and they start seeing their scalp, or they'll have diffuse hair loss, so it'll become thinner.
Mm-hmm. And I want to jump back into how easy this is to apply. We talked about it a little bit earlier, but let's touch on why we're choosing the PRP for hair loss.
Yeah, so typically with androgenic alopecia, people will think about Rogaine, so that's a medication and so forth. With PRP, why we choose that is because not really any side effects except for you do feel the numbing medication. We do numb the scalp. You're using your own blood, so there's no risk for any contamination or any reaction or rejection. And then also too is that it really does produce a great result, and then it usually lasts for about 2 years. You may have to have it done once, maybe every 2 years.
A great solution for people who are struggling with hair loss. Dr. Tracy Page, thanks for being here, and we want to thank you for watching To Your Health.